Hi, sorry to keep you waiting. I'm Dr. Mo. It's so nice to finally meet you. Dr. Patel has told me an awful lot about you and your case. I do need to go over some facts before we really dive in, okay? So just to make sure, first and last name, date of birth. Good. Any allergies to any medications or anything else that you're aware of? Okay, we got those too. Excellent. Do you have any history of diabetes, hypertension, congestive heart failure, any surgeries? Okay, and when was that? Okay. Any other surgeries? No? Okay. So this one's going to be a pretty big one for you then. Well, don't worry, we're going to take excellent care of you, okay? We have such a good staff here. Let me see, and then family history. I have you down for diabetes. Okay. Alright. Not a problem. Do you smoke? No? What about alcohol? How often are you drinking? Okay. Any other drugs, marijuana, over-the-counter prescriptions that I should know about? Okay. Okay, just to make sure that our files match the files that he sent over. So everything looks really good on my end. So our surgery is going to be tomorrow. How it's going to work is we'll take you back around 8 o'clock in the morning. All right, and the team will prep you. All right, and I will be there. I'm going to be your anesthesiologist. I will be the one helping you count down backwards and monitoring all your vitals and your lungs and everything like that, okay, during the surgery. And I'll be after the surgery there too, okay? I'm going to be helping you get off the ventilator because we are going to intubate you. Intubation can be kind of scary. But you won't know a thing about it, okay? I'm going to place a tube down your throat, okay? Down your trachea. And then I'm going to be filling your lungs with air. Alright, so I'm going to be breathing for you, essentially. Okay, because some of the sedation can be very strong. And with any sedation that can basically cut out your respiratory drive, so it will make you and your body forget to breathe, obviously. Yeah we want you breathing. That's definitely important. Exactly. So we put the tube down your throat and you'll be sedated for all of this, okay? You probably won't know unless you wake up with it still in that it's there, okay? Your throat can be a little bit sore afterwards, but most times the patients don't even realize it because they've had surgery on something else, right? And the pain from the surgery site normally takes over the pain. It's just a little sore throat, pretty minor. Okay? That's a good question. I can't fully tell you how long the surgery is going to take. The surgeons, when they get in there, they might find something that they weren't expecting, or, it's really hard to tell. Yeah. Sometimes when they put you under, this is heart surgery. This is a big deal, right? They're going to open up your chest and they're going to separate your chest to tell me if this is too much, okay? I want to educate you without scaring you. Okay, so you can handle it. Yeah, so they're gonna open up your chest and they're looking at your vessels, right? The blood supply to and from your heart. And we want those nice and open. We want you, circulating that blood flow. So, what they said is it's probably going to be a 2-vessel heart surgery. We'll see. If they get in there and they realize another one needs some attention, they're gonna do that while they're in there. That's why you signed the consent forms. Okay? No, 12 hours is a long time. Typically it's 4 to 8 hours, somewhere around there. Any questions for me? Okay, I'm gonna let you rest. And I'll see you tomorrow morning, okay? Okay. Bye now. Good morning. Hey, sweetheart, are you ready? Okay. How you feeling? Nervous? That's okay to be nervous. We all get nervous. That's all right. Well, I'm not nervous, but this isn't happening to me, and it's a big surgery, and I understand. That's a good reason to be nervous. So, real quick, before we sedate you, I want to see what your volumes are, okay? So this is your incentive spirometer. I know you've been working with the nurses using this, right? And the respiratory therapists. Good. So I want to see how high you can get this. Keeping in mind that you want to focus over here. This blue one needs to stay in between the arrows for as long as you can. Okay, this just helps me as an anesthesiologist know what your volumes should look like, okay? All right, go ahead and take it. All right, nice deep breath in. We'll do it 2 more times, okay? Best out of 3. 1, 2, 3, in. Good, keep going. Good, and out. You're doing great. 1 more time. 1, 2, 3, in. Good, go, and out. Good job. Okay. All right, that's right where the arrow was, so that's good. Okay, sweetheart, that is good for me to know. I'm gonna write that down real fast. 1400, that's pretty darn good. Okay. All right, honey. So they're setting up their stuff. And you can just keep talking to me for about another minute. I'm waiting for... You ready? Okay, yes, sir. Absolutely. Okay, sweetheart, so I've got your sedation here. I'm going to put it in your IV. So I'm going to push it nice and slow. I want you to start counting backwards from 10, okay? 10. 7. Yeah, good. 6. 5. Perfect. Dr. Brown, he's out. Hi, sweetie. Welcome back. Welcome back. Yeah. That's okay. She's still pretty out of it. That's alright. The sedation's probably in her system. That's totally normal. It takes a little bit of time to circle out of her system, so it's okay. Hi, sweetie. You're just a little sleepy. But the surgery went really well. It was just 2 vessels. 2 vessels like we kind of talked about. When they were in there, they didn't see any other damage to your heart. Other vessels looked good. Nothing was blocked, okay? Yeah. it was very clean. She's going to be extremely sore. He's going to be extremely sore. So, yeah. So your throat might feel a little bit sore, like I told you about. Your chest is going to be very sore for a while. Now, things to understand, we want to get you up and moving as fast as we can, okay? We want your lungs to get exercised. We want to exercise that heart as soon as it's safe to do so. Okay, and the nurses and the intensivist on this unit in the SICU, they're going to be monitoring that very closely, okay? So your homework is to listen to everything that they say, do everything that they say, okay? That's your quickest route to getting out of here and back home. Sorry? Yeah, that's right. That's right. We want to get you back home with family, okay? So as you're waking up slowly, that's okay. You're going to be given some pain meds, but not enough to kind of knock out that drive, okay? We talked about that before. We want you breathing. We want you exercising yeah. But we got to monitor your pain, because if you're in too much pain that you don't want to do the other things that we're asking you to do, then that's bad, right? We don't want that. So we want to stay on top of it without overdoing it, okay? It's a little tricky, but you're going to have to let the nurses know when your pain starts creeping up, okay? We want to keep it below a 5, all right? Not necessarily a 1, but 4 or 5, maybe even 6, but if it starts going up towards 10, we need to know. We needed to know a while ago. Okay? It's very important. Other things is this. I know you recognize it. This is also your homework. Right now, it is going to hurt so much to take a deep breath in, okay? That's just how it is. It's gonna hurt. You're expanding that chest, right? And that chest we just did surgery on, major surgery. So it's going to hurt. So I'm gonna put it down a little bit, but we need you to be doing this, okay? If you're watching TV, I need you to take a break, every single commercial break. Do this 5 times. Ideally 10, but we'll start with 5 today, okay? And it's the same motion. We want to expand those lungs and then exhale, okay? This is preventative, all right? We do not want your lungs to be sacrificed because you're not taking deep enough breaths, okay? Because then you're going to be here for a lot longer, and nobody wants that. You are on some oxygen right now. Carl, what's 6? You're on 6 liters of oxygen, okay? That's just a nasal cannula in your nose. Probably smells like plastic, sorry. But you're on 6, okay? We want to get you off of that. But we got you extubated. We got the tube out. You're off the ventilator. So you're already way ahead of a lot of people. Okay, you're on 6. It's not a crime to be on 6. You'll probably, move throughout the hospital on some oxygen. That's okay. But before you leave, we're going to get you back off of that, okay? Okay? Yeah, it went great. It went really well, as best as we could honestly hope for. Okay, so your blood pressure's up a little bit, but I assume that's pain related. We'll have to take a look at that. You're going to be on some medications. The nurse is going to go over every single medication with you before they give it, what trips you are on, everything. I'm going to let them take over here. I just wanted to tell you it went really well, okay? So, anyways, I'm so happy it went well. Thank you.